Hello everyone. Today we are going to see about the assessment of the cranial nerve 9 and 10, that is glossopharyngeal nerve and vagus nerve. Before getting deep into the assessment part, let's see about the nerve individually. Both vagus nerve and glossopharyngeal nerve are mixed nerve. Thus, it supplies both sensory and motor. Glossopharyngeal nerve originated from the medulla oblongata and leaves the cranium to the jugular foramen. Glossopharyngeal nerve has tympanic branch, carotid branch, pharyngeal branch, muscular branch, lingual branch and tonsillar branch. Vagus nerve has a meningeal, auricular, laryngeal, superior laryngeal, recurrent laryngeal and cardiac branch. Sensory supply of the posterior 1/3 of the tongue is done by glossopharyngeal nerve. Sensory supply of the palatine is done by vagus nerve. Motor function of the pharynx is done by glossopharyngeal nerve and visceral organ is supplied by vagus nerve. Sensory examination of the glossopharyngeal nerve is done by placing a piece of lemon or a food into the patient's tongue and ask them to feel the taste. If you can feel the taste?
Yes.
As she is normal, she can feel the taste, denotes there is no nerve damage, but if the patient can't feel the taste, denotes glossopharyngeal nerve damage. For the motor examination of the patient, make them in a comfortable sitting position and observe them while speaking and ask them to cough. And have a sip of water and observe the swallowing movement of the patient. Other motor examination includes ask the patient to say "ah" loudly, say "ah" and observe the deviation of the uvula. If there is any deviation, damage occurs. As she is normal, there is no any deviation. The most important motor assessment is the gag reflex. Ask the patient to open the mouth and depress the tongue with the tongue depressor and gently touch the posterior palatal wall and observe any deviation of the uvula. If any deviation occurs, denotes glossopharyngeal and vagus nerve damage. As she is normal, there is no any deviation.